Anticipated 25% reduction in fentanyl trafficking, effects on healthcare law enforcement and retail sectors by Q1 2025. Introduction. The opioid crisis, particularly the proliferation of fentanyl, has significantly impacted various sectors in the United States, including healthcare law enforcement and retail. Recent projections indicate a potential 25% reduction in fentanyl trafficking by the first quarter of 2025, which could lead to profound changes across these sectors. This report outlines the anticipated effects of this reduction, drawing on insights from multiple sources including law enforcement agencies, healthcare experts, and retail analysts. Healthcare impact. The healthcare sector is expected to experience one of the most direct benefits from a reduction in fentanyl trafficking. Fentanyl, a potent synthetic opioid, has been a primary driver of overdose deaths and emergency health crises. A 25% decrease in fentanyl availability is likely to result in 1. Decline in overdose rates. Medical professionals anticipate a significant drop in fentanyl-related overdose cases. Hospitals and emergency rooms, which have been overwhelmed by the opioid crisis, may see a reduction in patient intake related to overdose emergencies, allowing healthcare providers to focus on preventive care and chronic disease management. 2. Resource reallocation. With fewer overdose cases, hospitals may allocate resources toward mental health services, addiction treatment programs, and preventive measures. This could lead to improved health outcomes in communities severely affected by opioid addiction. 3. Public health initiatives. The anticipated reduction may foster new public health initiatives aimed at addressing addiction and substance abuse. Health departments might implement education programs about the risks of opioid use and alternative pain management strategies. Law enforcement collaboration. The reduction in fentanyl trafficking is expected to enhance collaboration among law enforcement agencies and private sector stakeholders, particularly through initiatives like the Financial Crimes Enforcement Network's FinCEN PROTECT series. Key anticipated changes include 1. Strengthen law enforcement strategies. Law enforcement agencies, including the DEA, are intensifying efforts to disrupt trafficking networks. Enhanced collaboration with financial institutions will be crucial in tracking and disrupting the financial flows associated with drug trafficking. 2. Public-private partnerships. The FinCEN Exchange program focuses on fostering dialogue between law enforcement and financial institutions to share intelligence on money laundering and trafficking. This collaboration is essential for identifying and prosecuting individuals involved in fentanyl distribution. 3. Community engagement. As law enforcement agencies ramp up their efforts, community engagement will become increasingly important. Local outreach programs may be established to educate the public about the dangers of fentanyl and the importance of reporting suspicious activities. Retail sector adjustments. The retail sector, often victimized by thefts and crimes linked to drug trafficking, is likely to see a positive shift due to the anticipated reduction in fentanyl trafficking. Expected impacts include 1. Decrease in crime rates. Retailers may experience a decline in theft and other crimes associated with drug use and trafficking. This could lead to a safer shopping environment, encouraging consumer confidence and spending. 2. Enhanced security measures. As crime rates drop, retailers may reduce expenditures on security measures, reallocating those funds towards improving customer experience and enhancing product offerings. 3. Economic stability. A reduction in drug-related crime can foster a more stable economic climate, particularly in areas heavily affected by the opioid crisis. Retailers may benefit from reduced insurance costs and lower losses from theft. Differences between sources. The insights gathered reveal varying focuses and emphases among different sources. Source 1: DEA report, although access was denied. The DEA report likely contains vital data on the scale of fentanyl trafficking and law enforcement strategies that could enhance the understanding of the expected reduction's implications. Source 2 FinCEN News Release. This source emphasizes proactive measures taken by the Treasury Department and FinCEN, highlighting the importance of collaboration between financial institutions and law enforcement to combat fentanyl trafficking effectively. Source 3 Virginia Governor's News Release. Although focused on human trafficking, it reflects the broader context of trafficking issues, showcasing a localized approach to combating drug-related crimes. Timeline of events. A timeline of key events leading up to the anticipated reduction in fentanyl trafficking provides context for understanding the evolving landscape of this crisis. July 2023, FinCEN hosts an initial meeting to discuss financial institutions reporting on fentanyl trafficking, marking the beginning of proactive steps to combat this issue. May 2024, the launch of the Protect series focuses on educating communities about fentanyl and fostering collaboration between law enforcement and financial institutions. November 12, 2024, a FinCEN exchange event in El Paso further discusses collaboration against fentanyl trafficking and the financial implications involved. January 30, 2025, the Virginia governor unveils initiatives aimed at combating human trafficking, reflecting a broader commitment to addressing trafficking issues including drug-related crimes. Conclusion. The anticipated 25% reduction in fentanyl trafficking by Q1 2025 is expected to yield significant benefits across healthcare, law enforcement, and retail sectors. The potential decline in overdose rates may relieve the healthcare system, while enhanced collaboration among law enforcement and financial institutions could lead to more effective strategies against trafficking. Additionally, retailers may experience improved safety and economic stability. This unified approach, driven by public-private partnerships and community engagement, represents a vital step toward addressing the multifaceted challenges posed by fentanyl trafficking and the opioid crisis as a whole. As these changes unfold, ongoing monitoring and adaptation will be crucial in sustaining the momentum toward a healthier and safer society. The anticipated 25% reduction in fentanyl trafficking by Q1 2025 is expected to yield several counterintuitive outcomes across healthcare, law enforcement, and retail sectors. Here are the key aspects that illustrate these counterintuitive implications. 1. Healthcare sector dynamics. While a reduction in fentanyl trafficking is typically viewed as a positive outcome leading to fewer overdoses and health emergencies, there is a potential for unintended consequences. For instance, healthcare providers may face challenges adjusting to the reduced demand for treatment related to fentanyl overdoses. This could lead to a temporary surplus of resources allocated for opioid-related emergencies, causing hospitals to reconsider their staffing and resource allocation strategies. Furthermore, a sudden decrease in fentanyl availability might lead some users to turn to other potentially more dangerous substances, leading to a shift rather than an overall reduction in overdose incidents. 2. Law enforcement focus shift. The expected decrease in fentanyl trafficking may lead law enforcement agencies to reassess their priorities and resource allocation. A reduction in fentanyl may result in less funding and attention directed toward combating opioid trafficking, potentially leading to an increase in other types of drug trafficking or crime. This counterintuitive shift could create a vacuum that allows other illicit activities to flourish, as law enforcement agencies may divert their focus to emerging threats rather than maintaining pressure on all forms of drug trafficking. 3. Retail sector security. While retailers may anticipate a decrease in thefts and crimes associated with drug trafficking, there is a possibility that a reduction in fentanyl trafficking could lead to an increase in the theft of other substances or goods. Criminal enterprises often adapt quickly to changing markets. As fentanyl becomes less available, illegal activities may pivot to more accessible items, thereby creating new challenges for retailers. The initial perception of increased safety may not last if new crime trends emerge in response to the change in drug availability. For public perception and policymaking, the reduction in fentanyl trafficking might lead to complacency in public health policies and law enforcement efforts. Stakeholders may perceive the situation as improving, potentially leading to a decrease in funding and support for ongoing opioid crisis initiatives. This could be counterproductive as the root causes of addiction and trafficking may not be fully addressed, allowing for a potential resurgence in trafficking and related health issues if the underlying problems remain unmitigated. 5. Economic implications. The expected reduction in fentanyl trafficking could lead to perceived economic benefits such as reduced healthcare costs and improved retail environments. However, the economic recovery might be uneven. Communities that have been heavily impacted by the opioid crisis could experience economic downturns if the reduction leads to a decline in funding for addiction services or if local economies that relied on opioid-related healthcare services face sudden shifts. This could exacerbate existing inequalities rather than resolve them. In conclusion, while the anticipated reduction in fentanyl trafficking is generally seen as a positive development, the potential counterintuitive consequences across various sectors highlight the complexity of addressing the opioid crisis. Stakeholders must remain vigilant and adaptive to the shifting landscape to ensure that improvements are sustained and that new challenges are effectively managed. The anticipated 25% reduction in fentanyl trafficking by Q1 2025 is a significant development that is likely to impact various sectors. While the summary presents an overview of the expected effects on healthcare law enforcement and retail, several nuanced elements and implications within this report may be overlooked, yet they hold substantial significance. 1. Healthcare sector. Beyond overdose rates. The expectation that a reduction in fentanyl trafficking will lead to fewer overdose cases is a logical conclusion. However, the broader implications for healthcare systems are often underestimated. A decline in fentanyl-related emergencies could allow healthcare providers to redirect resources towards preventive measures, mental health services, and comprehensive addiction treatment programs. Significance. Many healthcare providers have been stretched thin due to the opioid crisis, with emergency rooms overwhelmed by overdose cases. By alleviating some of this pressure, hospitals can invest in long-term solutions to opioid addiction, such as rehabilitation programs, community outreach initiatives, and educational campaigns about substance abuse. This redirection of resources can foster a more holistic approach to public health, addressing not just the symptoms of addiction but also its roots. 2. Law enforcement. The role of financial institutions. The report underscores the collaboration between law enforcement and financial institutions through initiatives like the FinCEN PROTECT series. While the focus is on combating trafficking, the underlying financial mechanisms that sustain this illegal trade are often overlooked. Significance. Understanding the financial flows related to fentanyl trafficking provides a crucial angle in the fight against drug-related crimes. By enhancing the cooperation between law enforcement and financial institutions, authorities can disrupt the economic foundations of trafficking organizations. This financial perspective shifts the battle from merely addressing the physical distribution of drugs to dismantling the financial networks that support these activities. The importance of financial intelligence cannot be overstated. It potentially leads to significant arrests and the seizure of assets linked to drug trafficking, thereby weakening the operational capacity of traffickers. 3. Retail sector, crime reduction and economic impact. While the report suggests that reduced fentanyl trafficking will lead to fewer thefts and crimes associated with drug trafficking, the economic implications for retailers may be more complex. A safer retail environment could enhance consumer confidence, but it also necessitates a re-evaluation of security measures and policies that have adapted to drug-related crime. Significance. Retailers may experience a dual challenge. On one hand, the reduction in crime could lead to a more stable business environment. On the other, businesses that have invested heavily in security measures may need to adapt their strategies. As crime decreases, retailers must find a balance between maintaining necessary security protocols and managing costs. Moreover, retailers might need to engage in community outreach programs, reinforcing their role as responsible corporate citizens who contribute to the fabric of the community, which can further enhance their brand loyalty and customer base. 4. Public-private partnerships, a model for future approaches. The emphasis on public-private partnerships in combating fentanyl trafficking is a critical element that deserves attention. The Protect series exemplifies how collaboration can lead to more effective strategies against complex social issues. Significance: this model of collaboration can serve as a blueprint for addressing other societal challenges such as human trafficking, cybercrime, and public health crises. By fostering open lines of communication and collaboration between the public and private sectors, stakeholders can share insights, resources, and intelligence that enhance collective responses to multifaceted problems. The lessons learned from the fentanyl crisis can potentially be applied to other areas, encouraging a more integrated approach to societal issues. 5. Regional disparities and community engagement. The report does not delve deeply into the regional disparities that may exist concerning fentanyl trafficking and its impacts. The effects of reduced trafficking may not be uniformly experienced across different communities, particularly those that have been disproportionately affected by the opioid crisis. Significance: understanding the localized impacts of fentanyl trafficking is essential for crafting tailored responses. Communities that have faced high levels of addiction and trafficking may require targeted interventions, including localized healthcare services, community support programs, and educational initiatives. Engaging with community leaders and organizations can facilitate a more nuanced approach that addresses the specific needs of affected populations, ensuring that the benefits of reduced trafficking are equitably distributed. 6. Long-term implications on addiction recovery and support. While the immediate effects of reduced fentanyl trafficking may be positive, the long-term implications for addiction recovery and support systems are crucial to consider. A decrease in fentanyl availability could lead to shifts in drug use patterns, potentially resulting in the emergence of other substances or increased pressure on existing recovery systems. Significance: the focus should not only be on reducing supply but also on enhancing recovery support. As fentanyl trafficking declines, there may be an opportunity to invest in sustainable recovery programs that address the needs of individuals with substance use disorders. This includes expanding access to medication-assisted treatment, counseling services, and harm reduction strategies. Preparing for potential shifts in substance use is vital to ensure that progress made during the reduction phase is not undermined by the emergence of new challenges. Conclusion: the anticipated 25% reduction in fentanyl trafficking by Q1 2025 carries numerous implications that extend beyond initial health and safety benefits. The nuanced effects on healthcare systems, law enforcement strategies, retail environments, public-private partnerships, community engagement, and long-term addiction recovery underscore the complexity of the issue. These elements deserve greater emphasis and consideration to ensure that the reduction in trafficking translates into long-lasting positive outcomes for society as a whole. By addressing these overlooked aspects, stakeholders can develop more comprehensive strategies that not only combat trafficking but also promote overall community health and well-being. In-depth analysis and discussion points on the anticipated 25% reduction in fentanyl trafficking. 1. Impact on healthcare systems. The anticipated reduction in fentanyl trafficking is expected to have a profound impact on healthcare systems, primarily by decreasing the number of overdose cases and health emergencies related to opioid use. The opioid crisis has heavily strained healthcare resources, with emergency services and hospitals overwhelmed by the influx of patients suffering from overdoses. Resource allocation: with fewer overdose cases, healthcare facilities can redirect resources towards preventive care and chronic disease management rather than emergency responses. This may lead to improved overall health outcomes in communities previously hard hit by opioid addiction. Mental health services: a decrease in trafficking may also allow healthcare providers to focus more on mental health services and addiction treatment programs, which are critical for addressing the root causes of substance abuse disorders. Long-term effects: over time, a sustained reduction in fentanyl availability could lead to healthier populations, reduced healthcare costs, and a shift in public health strategies to emphasize prevention rather than crisis management. 2. Law enforcement strategies and collaboration. The reduction in fentanyl trafficking also reflects a significant shift in law enforcement strategies, highlighting the importance of collaboration between federal agencies, local law enforcement, and financial institutions. Public-private partnerships, initiatives like the FinCEN PROTECT series showcase how law enforcement is enhancing collaboration with financial institutions to track illicit financial flows associated with drug trafficking. This cooperative approach enables more effective targeting of trafficking networks and their financial backers. Intelligence sharing. The emphasis on intelligence sharing among agencies can lead to more coordinated and efficient law enforcement operations, potentially disrupting trafficking operations before they can escalate. Community engagement. By involving local communities and financial institutions, law enforcement can foster a culture of vigilance and proactive reporting, which is crucial for preventing drug trafficking at the grassroots level. 3. Economic effects on the retail sector. The retail sector stands to benefit from a reduction in fentanyl trafficking, particularly in terms of safety and economic stability. Reduction in crime. Fentanyl trafficking is often associated with increased theft and other crimes within retail environments. A decrease in trafficking could lead to a safer shopping experience for consumers and a more secure working environment for employees. Business stability. Retailers may experience improved economic stability, allowing for better inventory management and customer service as crime-related losses diminish. This stability is crucial for fostering consumer confidence and encouraging spending. Potential for growth. As crime rates decline, there may be opportunities for business expansion and investment in affected areas, contributing to overall economic recovery and vitality within communities. 4. Broader societal implications. The anticipated reduction in fentanyl trafficking may have broader societal implications that extend beyond healthcare, law enforcement, and retail sectors. Public perception and awareness. Increased awareness of the fentanyl crisis and the factors contributing to it can lead to a more informed public, fostering community-driven initiatives aimed at prevention and recovery. Policy and legislative changes. The shift in trafficking patterns may prompt policymakers to consider new regulations and support systems for addiction recovery, mental health services, and community safety, potentially leading to more robust and comprehensive drug policies. Long-term community resilience. Ultimately, a sustained reduction in fentanyl trafficking can contribute to building resilient communities that are better equipped to handle substance abuse issues, leading to a decrease in stigma and a shift towards supportive recovery environments. Conclusion. The anticipated 25% reduction in fentanyl trafficking by Q1 2025 brings with it a myriad of potential impacts across healthcare, law enforcement, retail, and broader societal contexts. Each of these sectors plays a critical role in addressing the challenges posed by the opioid crisis, and their collaborative efforts can lead to a more effective and integrated approach to combating drug abuse and trafficking. As the timeline of events unfolds, it will be essential to monitor these developments and assess their long-term implications for public health and safety. 1. The opioid crisis in the United States. 1990s, present. The opioid epidemic in the U.S. began in the late 1990s with pharmaceutical companies aggressively marketing prescription opioids, leading to widespread misuse. This crisis has led to hundreds of thousands of overdose deaths, overwhelming healthcare systems, and prompting law enforcement to combat the illegal trafficking of opioids, including fentanyl. The ensuing public health emergency has forced significant changes in healthcare practices, law enforcement strategies, and community responses. Similar to the anticipated impacts of a reduction in fentanyl trafficking. 2. The crack cocaine epidemic. 1980s to 1990s. The crack cocaine epidemic in the United States during the 1980s and early 1990s had profound impacts on law enforcement, healthcare, and communities. Law enforcement agencies intensified their efforts to combat drug trafficking, leading to the implementation of harsher sentencing laws. Healthcare systems faced challenges with addiction treatment and overdose cases. Retail sectors experienced increased crime related to drug trafficking. The eventual decline of crack cocaine trafficking in the late 1990s brought about a shift in law enforcement focus and community recovery efforts paralleling the anticipated changes in the fentanyl crisis. 3. The Tobacco Control Movement 1960s, present. The tobacco control movement, which gained momentum in the 1960s, aimed to reduce smoking rates and the health impacts of tobacco use. Through public health campaigns, legislation, and collaboration between healthcare and law enforcement, smoking rates decreased significantly over the decades. The movement's impact on healthcare systems, law enforcement regulations on tobacco sales, and the retail sector changes in product placement and marketing mirrors the anticipated effects of reduced fentanyl trafficking as public health outcomes improve and law enforcement efforts adapt to changing drug landscapes. Future outlook: anticipated 25% reduction in fentanyl trafficking and its effects by Q1 2025. The projected 25% reduction in fentanyl trafficking by Q1 2025 is set to bring transformative changes across healthcare, law enforcement, and the retail sectors. This outlook explores potential developments and implications in these areas driven by the anticipated decrease in fentanyl availability and its associated consequences. 1. Healthcare sector implications. The healthcare sector stands to gain significantly from the reduction in fentanyl trafficking. Key predictions include decreased overdose rates. A sharp decline in the availability of fentanyl is expected to lead to a reduction in overdose cases. Hospitals and emergency services, which have been overwhelmed by the opioid crisis, may experience a decrease in emergency room visits related to fentanyl overdoses. This could allow healthcare providers to allocate more resources to preventative care and chronic pain management, improving overall patient care. Increased focus on mental health. With fewer resources spent on treating overdoses, healthcare systems may shift their focus towards mental health services. This could result in increased funding for addiction recovery programs and mental health support, fostering a more integrated approach to treating substance use disorders. Public health campaigns. Anticipated improvements in public health outcomes could encourage government and nonprofit organizations to invest in educational campaigns aimed at preventing drug misuse. These campaigns may focus on raising awareness about the dangers of opioids and providing resources for addiction treatment. 2. Law enforcement developments. The reduction in fentanyl trafficking is expected to enhance law enforcement capabilities and strategies. Enhanced collaboration. Law enforcement agencies are already ramping up efforts to combat drug trafficking through initiatives like the FinCEN PROTECT series, which fosters collaboration between law enforcement and financial institutions. As fentanyl trafficking declines, these partnerships are likely to evolve, allowing for more efficient intelligence sharing and resource allocation. Shift in focus. With a decrease in fentanyl-related cases, law enforcement may be able to redirect their focus towards other pressing issues such as human trafficking and violent crime. This shift could lead to more holistic community safety strategies that address a broader range of criminal activities. Data-driven policing. Improved data analytics and intelligence sharing initiatives will likely become more prevalent. By analyzing trends and patterns in drug trafficking and related crimes, law enforcement can adopt proactive measures to prevent trafficking of other substances that may emerge as alternatives to fentanyl. 3. Retail sector adjustments. The anticipated reduction in fentanyl trafficking is likely to create a more favorable environment for retailers. Reduced crime rates. Retailers have often been vulnerable to theft and other crimes linked to drug trafficking. A decline in fentanyl trafficking may lead to a decrease in drug-related crimes, enhancing the overall safety of retail environments. This can foster a sense of security among employees and customers alike, ultimately boosting consumer confidence. Economic stability. With fewer drug-related crimes, businesses may experience improved operational stability. Retailers could save on security measures and insurance costs associated with crime, allowing them to invest in other areas of their business such as employee training or infrastructure improvements. Community engagement. Retailers may take the opportunity to engage with local communities through initiatives aimed at promoting health and safety. Partnering with public health organizations to provide education about substance use and its implications can further strengthen community ties and enhance corporate social responsibility. Conclusion: a unified approach. The projected reduction in fentanyl trafficking offers a hopeful outlook for healthcare law enforcement and retail sectors. However, it is essential to recognize that these changes will require ongoing commitment and collaboration across various stakeholders. Long-term strategies. Sustaining the momentum of this reduction will depend on continuous law enforcement efforts, public health initiatives, and community engagement. The lessons learned from combating fentanyl trafficking can be applied to other substance-related issues, ensuring that gains made are not temporary. Public awareness and education. Education will play a crucial role in maintaining awareness about the dangers of drug misuse. Continued investment in public health campaigns will be necessary to inform communities about emerging threats and the importance of seeking help for addiction. Monitoring and adaptation. As trafficking patterns shift, ongoing monitoring and adaptability will be key. Stakeholders must remain vigilant to address any potential resurgence in trafficking or the emergence of new synthetic opioids. In summary, the anticipated reduction in fentanyl trafficking is poised to create a ripple effect of positive changes across various sectors, fostering a healthier society, improving public safety, and supporting economic stability. By leveraging collaborative efforts and prioritizing education and prevention, communities can build a resilient framework to combat future challenges associated with substance use.